Dr. Allegretti, when you speak to people living with IBD in your practice or at conferences, what are some of the most common questions or comments you hear?
Yeah, so I would say by far and away, the most common question I hear from most of my patients is, how long am I going to be on this therapy, right? When we're having the initial conversation around which therapy we're going to start, before we've even started it, patients are often asking, well, when do I get to stop this? And I often have to remind my patients, unfortunately, this is a chronic condition, and I genuinely hope in your lifetime we have a cure, and we are working towards that goal. But as of now, we still don't have a cure for either ulcerative colitis or Crohn's disease. So most patients will need to be on some form of therapy, lifelong. We also often have really in-depth conversations, around various safety concerns. Many patients, they see the commercials, they've read things on the internet, or they know somebody who's had, a certain experience. And I think discussing those concerns up front, addressing them, and really educating the patients around the facts, I think is really important.
Given your experience as well as expertise, what advice would you give to women with IBD on building a strong partnership with their healthcare team? What steps can they take to advocate for themselves with the goal of ensuring comprehensive and personalized care?
Yeah, so I would say something that I see almost universally with my female patients and not with my male patients is this constant need to apologize. Don't apologize for discussing your symptoms. We're gastroenterologists. We want to hear about your bowel habits. We want to hear about your symptoms. We want to hear about all of it. So don't feel embarrassed, don't feel shy, and certainly don't feel like you need to apologize. That's what you're there for. Ask questions. I know sometimes these visits can feel overwhelming, so I always recommend write things down ahead of time so you can come in clear and prepared. I always say it never hurts to bring, a second set of ears with you as well, especially if you're meeting a healthcare provider for the first time. And I think it's really important if you're coming in with concerns or things that you're worried about, bring those up front. Verbalize those concerns to your healthcare provider early in that conversation so that they can really work to address those concerns in an appropriate way. And I think then you leave that appointment educated and feeling much better about the interaction.